Hi, I'm Emily Martin, an LCSW, which is a licensed clinical social worker here at Summit Emotional Health. I graduated with my Master of Social Work in 2003 from VCU, and I've worked in many outpatient settings since then, both in Richmond and in DC. I've worked in private practice since about 2010, and I joined Summit in February 2025. Our intake session is basically a get to know you time. We figure out what's brought you in for services, and we talk a lot about that. I'm going to ask you probably a lot of questions about your personal history, and it's a time for us to build some rapport together. I want to also make sure that you have the time to ask me questions about what your hopes or expectations might be around therapy, so moving forward, we know that this is a good fit and that you're getting what you want out of treatment. For a lot of my clients, they are walking into a therapist's office for the very first time and talking about something that is very personal or possibly emotionally charged to somebody brand new can feel really, really scary. So I want to make sure that this space is as comfortable and nurturing as safe as possible. Gratitude is something that helps me stay grounded during my busy weeks. It's something that I've been using for over 10 years now, and I utilize it by having an internal dialogue with myself. Like many of my clients, I have many roles in my life, and while they can give a lot of love and support, they can also contribute to feelings of worry and anxiety and agitation. And so in those moments, I try to remind myself to think about what I am grateful for, to think about what is working or what I do have. And I find that that kind of balances the scales, which gives me the energy and bandwidth to deal with those frenetic moments or those challenging situations.